the glands that create hormones. Just one, Abby. Ovaries.
Yeah, ovaries.
Pituitary glands, adrenal glands. This is low-key my work, so I need to like...
I was 22 because I never had pimples or acne growing up. So imagine me being a full-blown adult entering my bad bitch era and I'm getting pimples on my forehead. So I realized it was hormonal because it was adult onset and it was much later in my life.
Between the ages of 25 to 28, I'd have really bad breakouts. And it wasn't all over my face, it'd be predominantly here. Those big, horrific ones. And I went to the doctor and he diagnosed me with hormonal acne and put me on antibiotics.
I think when I was in my late 20s, I just experienced like late adult acne and it just kind of like blew up.
I think what helped me with that was my diet. I changed my diet. And that had a massive difference on my skin, it cleared it up, so yeah.
I try to normalize having acne. So on my Instagram, I don't think I've used filters on myself in like maybe 2 years or something. If I have a scar, if I have a pimple, I'm still recording in the videos because it's like we need to normalize the body doing what the body does. But definitely when it first started, I remember when I was like 22, I was really conscious about it. I would put makeup on and all, but then sometimes makeup makes it worse. So I was just like, look, I have this, you're gonna see it and you're gonna live with it basically. But thankfully, I think my skin is in a much better place.
Do you have any other issues?
Yeah, so I have PCOS as well.
PCOS is polycystic ovarian syndrome. Basically, it is an abnormality in metabolism and production of androgens and estrogens. Now, these are hormones, really. Androgens being a predominantly male sex hormone, whereas estrogen, of course, is a predominant female sex hormone. The androgens, the most popular ones we have is testosterone. And then PCOS basically develops from an abnormality in metabolism or production of those hormones.
So how did you discover that?
My cycles were kind of weird. I had a 50-something day cycle at some point and I'm like, okay, this is a little scary what's going on. And yeah, so I went and I saw a gynecologist, I had a scan done and they're like, oh, polycystic ovaries and stuff.
The commonest way most women or ladies tend to know that they have polycystic ovarian, or the first thing that a woman comes to you as a doctor and then reports to you is menstrual irregularities. You come to the hospital and then you're like, okay, I've not seen my period for 6 months. I don't know what's going on. I've done pregnancy tests and then it says I'm not pregnant and yet I'm not seeing my period. So what's the issue?
It was scary at the time, but then as with a lot of things, when you have a lot of information and you do your research and you realize how normal it is and the treatment options as well, you live with it.
Because I've already had some issues in the past, dealing with my mental health. When it came to my issues with the cyst and all of that, I have a massive fear of not being able to have kids, even though I'm not trying to have kids or I don't really know if that's what I want, but the fact that I don't have I'm not sure if I have the ability to or the access to or the potential to stresses me out a lot, and that is a big player on a lot of anxiety roots that I have, and so it's a very stressful subject.
You could see your period and not be ovulating. So is one of the things that brings, and then hyperandrogenism syndromes that people come up with, and then like hirsutism, hoarseness of voice, acne and things like that. Also we have other metabolic complications, symptoms like diabetes, for instance. It is quite common with polycystic ovarian syndrome. Also, aside from that, you have obesity too. Most people with polycystic ovarian syndrome tend to be on the big side. And so those are like symptoms that you see, and then you're like, this person probably has polycystic ovarian syndrome.
I mean, the first gynecologist told me I should lose 8 kg. I was like, bitch, no. Because to be fair, weight loss does ease the symptoms, and sometimes it helps your cycle become more regular. But there was no way. I was like 68 at the time. This thing goes, oh yeah, just drop 8 kg. I'm like, I'm not starving myself to do that. So yeah, I think that sometimes in gynecology as well, you find that men, because they don't experience what we experience, they're very textbook answer to your solution, to your problems, and mentally it doesn't feel very soothing.